Hi everyone, this is Kirsten and I decided to make a video on my specific program for bariatric surgery and talk about this lovely thing, my patient handbook, or I like to call it my bypass Bible because they gave it to me in my very first bariatric appointment and it was the most wonderful thing they could have ever given me and it is so useful. So I decided to talk about it. Alright, so I live in Minnesota. And my bariatric program is a 20-step process. It is very, very long. Surgery isn't until step 17. So it's kind of grueling, but I feel like it's worth it because there's so much that you have to know for the surgery, and if you aren't informed, you can get in a lot of trouble. This is your body. So like, I want to know every precaution or everything that could go wrong. I want to know about it. Anything that I can do to prevent it going wrong, I want to know about it. So my Bible is life. Pretty much they told me when they gave this thing to me, if you have any questions, the answer's probably in here. It literally talks about anything you can think of, from vitamins and I guess I'm going to talk about it. So my process, they gave me this little chart thing, like the step-by-step process. So there was not a moment in this entire thing that I did not know what was going on. And the first thing that we had to do was attend a seminar on a class that teaches about bariatric surgery. It talked about all the different kinds. It talked about the different surgeons that were there, and we got to meet a surgeon. We got to meet all the nurses, which was really, really cool. So that was that, and then the second step is decide if you want to do the surgery. So that was really easy. I marked that box off right away. And then the third step is complete like a diet or a health history and diet form. So I had to complete like a packet like that thick about like family history of diabetes, heart disease, religious information. It was an insane packet. And then your next step 4, is meet with a bariatrician. And yeah, so I met with a doctor who specifically works with bariatric patients, and she, lucky enough, studied endocrinology for an additional 4 years, working specifically with polycystic ovarian syndrome women, and so she definitely knew what I was talking about from the moment I went in there. And I was like, I asked her all the questions. Am I too young for this? Is this the right choice? And what type of gastric bypass she recommends, because there's 3 different kinds, 3 or 4, and we talked about everything, and she was wonderful, super happy, and like didn't make me feel bad about my weight. It didn't even feel like a weight doctor's appointment. She talked about some things we can change, and that counts as like a structured weight loss. And then she literally pulled out a sheet of paper. Go away, Holly. She literally pulled out a sheet of paper with a checklist of things that I'm going to have to complete, which is essentially the same thing as this, but it's a little more detailed with my doctor's names and my weights and things that are like really specific on it, so I'm not going to pull that out because it's got some personal stuff on it. But the next thing that you do is you say hello to happy new eating habits. And then the next thing is see a nutritionist, and you have to see the nutritionist at least 2 times before they'll sign you off for the surgery. And then you may or may not have to see a physical therapist. I don't, because I don't have any like physical like activity problems. I can walk just fine. I mean, it's not very long, but I'm not confined to a couch, I should say. And then you have to have a behavioral assessment, and then you meet with your surgeon. And you can kind of do those in any order. You don't have to. I saw my surgeon before I saw my nutritionist or my psychologist. So it kind of just depends. And then you have to attend a support group. Go lay down. You don't need to be in my lap. So I had to go to a support group where I met with post-op people and pre-op people that were around my size, and there was about 60 people in that class. It was packed. And it was so cool because I ended up sitting with all the post-op patients, and that was probably like the greatest thing ever, because there were some people that were a year out, there were some people who were 8 weeks out, there was a lady in there who had surgery 6 days ago, and she was just happy as can be sitting in there going like, I'm doing great, this is awesome, it's not as terrible as I thought it would be. And it was so cool. being able to talk to people who have gone through what you're going through is like, nobody can relate to it, honestly, unless you're there, unless you're in it and you're overweight and you're trying to pull yourself through this. There is nothing that compares to being sitting in a room with all these people who we're all working for the same goal, and we're all like encouraging for each other, and it feels like a family. Like, they didn't know me from anywhere. It was my first meeting that I'd ever gone to, and like they took me in their arms. Like I was just, it was wonderful. Everything about it was wonderful. And my mom went with me and she really enjoyed it, so that was cool. Like, and then step 11 is like schedule an appointment with a primary care provider. I didn't have to do that. Not going to do that. My primary care doctor doesn't even know I'm doing this. And my reason is because I mentioned to her, and I'm sure if I went back and brought it up to her again, she'd kind of have a different perspective, but she likes to treat my symptoms, but not really treat the weight problem, because she knows that I'm allergic to fruits and vegetables. She knows I have polycystic, so we just switched her on birth control a million times to see if that would fix it. Or if I wasn't sleeping at night, she'd give me something to help me sleep. And like, she's really great and I love her and I wouldn't trade her for anything, but I think she's just worried about like the long-term changes that you're making to your body when you have gastric bypass, because I am young and it is a major surgery. So like it's really drastic and it is only a last resort thing, and I don't think she understands how much of a bear this is for me, and how like I am at my last resort already. Like, I'm doing this now. And then everything, you go see specialists. So like if you need a sleep study, some people need EKGs, some people need like, I don't really know what else, because I didn't have to do anything other than a sleep study. If your neck is 16 inches around, they make you do a sleep study, but I was totally okay with that because I knew I couldn't sleep right anyway. What else was on this one? Oh, some people have to go see a dentist because if your teeth aren't good enough for the surgery, they won't do it. Some people have to have colonoscopies, mammograms. Like, if you're drinking or smoking, you have to stop 30 days within surgery, so you have to like take a bunch of tests for that. Mammograms. Yeah, sounds about it. And so yeah, the specialist, I already did that, so I'm good there. And then it all goes to insurance. After you've done your 2 appointments with your psychiatrist, your 2 appointments with your nutritionist, depending on whether or not your insurance requires structured weight loss. Because if they do require structured weight loss, depending on your insurance requirements, it could be as long as 6 months or none at all. And mine was unclear, so they didn't state, so we're just kind of guessing. And then you have to take, after your insurance gets like everything together and you get approved, you meet with your surgeon, or they call you to schedule your surgery, and then you have to attend a preoperative teaching class where they teach you everything that you need to know before you go to surgery. And then you have your surgery! Yay! And then you have to participate in their follow-up program and attend their support groups post-op. And then you experience new beginnings, which is step number 20, which I'm getting there, so pretty happy about that. So that's my program in a nutshell, a 8-minute and 49-second nutshell. This thing, I will try to be fast, because I know that this video is getting long already. This is my life, my baby. I don't know what I would do without it. I would probably cry. When I saw my bariatrician, which is step number 4, they gave me this. And there's even a table of contents because it is insanely long. There's 5 tabs. One says, welcome to bariatric care. The second one says weight loss surgery. The third says post-op care, nutritional information, and pharmacy information, because everybody knows there's lots of pills you can and cannot take after surgery because your stomach is highly sensitive, such as the list of NSAIDs that you can't take, the things that you can take, blood pressure medication, all that fun stuff. And if it's just a temporary restriction or a permanent, my program specifies, I know that I've seen some people say differently on other blogs, but my program says no NSAIDs ever after surgery. So I know some people are like, I've been cleared for NSAIDs, and I'm just like, not gonna do it. I don't want to risk it, I guess, because I've had enough stomach problems. So the first intro talks about like phone numbers if I need to call on anybody, which is fantastic because I've used it, fax numbers to mail in information for my other doctors. And then it says weight loss surgery. The first tab, it talks about like the different kinds of procedures versus open and laparoscopic, what to expect with each different kind, the surgical risk. There's literally like a long thing of all the things that could possibly go wrong with the surgery. And then preparing for surgery, which is awesome. Support groups, exercises, pregnancy and weight loss surgery, so how long you should wait before you decide to have a baby, which is not a problem because I'm not having kids for a while. Getting insurance approval, the things you have to give up, like saying goodbye to caffeine, that's a section in here. And then this is what I really love. 30 days before surgery. They literally have a breakdown of everything you should and should not be doing before surgery, and it goes 30 days to 2 weeks, and then 7 days before surgery, 2 days before surgery, and the night before surgery. So like when to be going on your clear liquid diet. It even talks about like how to shower before your surgery. So things that I didn't even think of, they put in this binder. There's literally what to bring to the hospital, which is great because I never thought or cared about that. And then the day of the surgery, that's got its own like section too. So the morning of the surgery, as soon as you get to the hospital, there's literally a step-by-step list of everything you're gonna do. So it talks about even like when you're gonna see your family, when you say goodbye to your family, when you get dressed, when they put an IV in your arm, it's all in here. So that's fantastic. And then in the operating room, they even have a list of things that they're doing in there, except for the actual procedure, because that varies by patient and whichever kind of surgery you're getting, obviously. And then in the recovery room, so it'll talk about your experience there and then how to rate your pain and post-operative general care. So they've got like pain management and how to do all that fun stuff. And it talks about everything that you could, this is the second tab, or the third tab, by the way, post-op care. When to call a surgeon if something's wrong, how to manage your pain, how long you should be out of work, how much weight you can lift, what your bowel habits are going to be like, what to expect with your hair. And then it even talks about, and this is what I really, really like, it talks about a lot of emotional stuff, which nobody really thinks of, but like head hunger and like it talks about depression, hibernation syndrome, like some people just like hide in their house after they have gastric bypass surgery because it's just stressful. Lots of cool stuff. It even talks about like losing friends and because people are jealous and partner jealousy, and it even has a section on divorce, and I'm not married, so that doesn't apply to me, but I thought that's pretty cool. And then body image, like what kind of binder talks about like how you're gonna feel after gastric bypass surgery, because that's important. That's half the battle is all up here, and if you don't know what to expect, you're going to get your hopes up, and then you could come spiraling down and crashing, and it's just not going to go well, and my dog is driving me insane. So, and then it's got like a list of like when you should have your follow-ups and who you should have them with, like your surgeon, because you have a follow-up with your surgeon 2 weeks later, depending on your surgery type, and your bariatrician, dietitian, and lab work, and all that fun stuff. So it literally breaks it down for a year and a half of when you should do that. And then nutritional information. I have a gigantic tab of diet stuff. So like not eating and drinking at the same time, how many grams of sugar I should be having in a meal, different types of protein. Can you go away, please? Seriously, you're killing it right now. Sorry. Dumping syndrome, which will be with mine because I'm having RNY gastric bypass. So dumping syndrome is something that I can experience, and it talks about like what the symptoms are and how to prevent it with your food, limiting types of sugars, how to read a nutrition label, portion size advancement. So a lot of people don't know how much they should be eating at what points after gastric bypass. My type, you'll only be eating 1/4 of a cup for the first 3 months. And then 3 to 6 months, you should be eating about 1/2 a cup. And then 6 to 9, 1/2 a cup to 3/4 of a cup. And then 9 and 12 and beyond, it should be 3/4 to a cup of food per meal. And then never more than that. But you don't have to eat the full portion size. They put in big bold letters to remember to always stop eating when you're satisfied. And then it even gave me a list of like things that I should shop for. Nutrition rich shopping list. Nutrient rich, I should say, sorry. And then it has a breakdown of like when to come off the liquid diet, when to start the liquid diet, things that you can have on the liquid diet, soft solids, regular diet, and then I have a sheet specifically for vitamins. Everything that I should be taking vitamin-wise, it's easy as 1, 2, do D. And I already take all of them now, so I don't have to worry about that later. I have a giant pillowcase. And then that's about it. And then all the pharmacy stuff. So no NSAIDs, and this also breaks down to how many days before surgery you should be taking what. So like 30 days before surgery, 14, what you can and can't take. It's pretty great. So that's about it. That's my program. I don't think you care about driving directions to the hospital. I've had it memorized by now because I've driven there like 30,000 times for all my appointments. But it's a wonderful program. I have wonderful teams of doctors. I love every single one of them. They have made me feel comfortable and excited, and they know that I'm doing this and they think it's fantastic, and I hope I can find all the support that I want and need, and I'm taking it day by day, you guys, so I'm excited because it's getting there, and it's going to be happening, and soon I'll be posting like after videos, and that's what everybody cares about because they want to see like what you've done. And so far I've lost 5 pounds, and I know that doesn't seem like a lot, but that's the start, and that's 5 pounds I'm never getting back. So keep pushing. Thank you, everybody. Bye.